There is major happenings in women's health, and I am so excited about it. Last month, the FDA opened a discussion panel on the Women's Health Initiative and the black box warning that is currently on hormone replacement therapy. Now, what is a black box warning? It says, warning, endometrial cancer, heart attack, and stroke. It's really scary, and it's at the top left-hand corner of any handout that you get when you pick up any kind of hormone replacement therapy. So finally, last month, the FDA decided that they needed to relook at it. And so a panel discussion happened, and multiple doctors were discussing the benefits of hormone replacement therapy and how for 23 years, women have been misled and afraid to take hormones. It all started in late 2002 when the evening news came out and said, warning, hormone replacement therapy doesn't have the benefits that we thought it would, i.e. preventing heart disease, and it increases your risk of breast cancer. That hit the evening news, and women across the country went off their hormones. Hormone replacement therapy dropped from 40% of eligible women to 4% of eligible women. So many women have suffered since. Women going into menopause heard that, and then the doctors who were caring for women in menopause heard that, and not enough people looked at the data that came out afterwards that said, whoa, this study wasn't done very well. It wasn't really looking at women early in menopause. It was looking at women who were in their 70s when they started hormone replacement therapy. Newsflash, if you have heart disease, it can't prevent heart disease. And if you're in your 70s, your chances of already having pre-existing heart disease is pretty dang high. Finally, they're looking at it again. In fact, the commissioner of the FDA is on record saying on the news that he thought the FDA black box warning for hormone replacement therapy was one of the worst mistakes in the last 20 years in medicine. Wow. Here's a question. Have you seen that on the news? No, because bad news makes the news. Good news doesn't make the news. Now, this is still in the investigative stages. I hope that they actually convene and make the decision to remove that because women have been misled for so long. Right now, they're looking at getting comments. It's an open forum. This is going to last until middle of September, the open forum for people to write in and talk about their opinions on whether hormone replacement therapy is helpful or harmful and what do we think the FDA should decide there. I don't know exactly when they're going to vote on it, but at least people are flipping talking about it right now. I have a little bit of hope. Functional medicine and integrative medicine and longevity medicine, we've been saying this for decades. Wait a minute, let's look at hormone replacement therapy benefits. And if it's done right, we've been saying for a long time that we think it's safe. An important thing is what is done right. I don't want people to go back on hormones thinking that all hormones are safe because all hormones are not safe. The study showed that for estrogen, you should have transdermal estrogen. Well, number one, let's make sure it's bioidentical, which means at the molecular level, it has the same exact shape that your ovaries used to make. As opposed to something similar, but not exactly identical, it will have side effects that it shouldn't have because shape determines function. And whatever shape fits on whatever receptor, that's what response gets triggered. Let's not use horse urine. Let's not use horse estrogens. Let's use human shaped estrogen. Let's use the safest form, which is transdermal. I know people who think they're doing the right thing and they're taking estradiol, which is bioidentical estrogen, but they're taking it orally. That doesn't work. There's several factors. One is that it needs to be bioidentical so that it doesn't have funky side effects. The other is, though, that it needs to be delivered to your body in the safest fashion. See, when you take a pill of estrogen, you have to digest it before it gets distributed to your body. And in the act of digestion, it goes from your gut to your liver. And in the liver gets a massive dose of this hormones through a portal vein. Through that, it turns into inflammation. It's inflammatory mediators are released in the liver when you take oral estrogen. So that's why you have that label on birth control pills that they increase your risk of heart attack and stroke. So please don't put estrogen in your mouth. I don't care if it's Premarin or estradiol or ethinyl estradiol. It shouldn't be taken orally. And so that's one component of safety. Right hormones, right route. Let's monitor the levels. Good grief, what a concept. We don't need the estrogen level of a 20-year-old. We need to have stable estrogen levels that are above the threshold so that our bones are healthy, our brain is healthy. When you're cycling in the early fertility years, right, your hormones change by 300% depending on where you are in your cycle. So we don't need those waves anymore. Let's have a steady state. Let's monitor the levels to make sure that the estrogen and the progesterone are balanced. The progesterone has calming effects. The progesterone is good for the endometrium. That's the lining of the uterus. If you take estrogen alone without a progesterone, it stimulates the uterus. It wakes the uterus up and it stimulates the endometrium to grow. And unchecked growth of the endometrium leads to potential issues. It can cause endometrial hyperplasia, which is a precursor to endometrial cancer in some forms. So we need to have a balance of estrogen and progesterone. And then the last component of safety is to make sure that your body metabolizes the hormones right. There's 3 different pathways that estrogen gets metabolized down. And depending on which pathway is most active, there might be a risk. So there is a pathway of estrogen that's not a happy pathway. I call it the ugly estrogen pathway. And it's the 4-hydroxyestrogen pathway. That pathway, if it is left alone and not metabolized, there's a mop-up method, thank God, right? God was not silly. He gave us backup pathways so that if one pathway doesn't work well, there's cleanup pathways. Otherwise, we'd all be dead from all of our toxic exposures. If it's not mopped up, then 4-hydroxyestrogen pathway leads to precursors that damage DNA, which is a risk for estrogen-related cancers. Now, the only way you can check that is in a urine study. So in our practice, we use bioidentical hormones. We monitor the levels. We make sure that we deliver the estrogen transdermal, that is estradiol, bioidentical, and then we balance them through monitoring. And periodically, we do a urine hormone study to make sure that you're metabolizing your hormones safe. And if we do all of those things, then you can stay on the hormones for a long time and get the benefits. So I hope this is helpful for you. Please follow this. Please encourage your doctor to reach out to the FDA in favor of accurate information about hormone replacement therapy benefits and risks. Quit trying to scare women with this black box warning. If you find this helpful, please follow me.